My name is Craig Query with Pathway Genomics, and we specialize in healthy weight DNA and genetic testing. So Dr. Ryan and Dr. Josie can now give their patients more specific advice as to how they balance the breakdown of fats, carbohydrates, and proteins, and they can get them on the genetic appropriate diet based off of their own genetic predispositions.
Okay. So it's common that people, are finding they're gluten-free, they're lactose intolerant, things like that.
Right.
Is that something that this test tests for?
We can also give gluten-free diet guidelines. So we have standard diet guidelines and gluten-free diet guidelines based off of whether the customer is gluten-free or not. But our test really doesn't tell them if they should be gluten-free.
The test is administered in what way?
So basically, it's a simple saliva sample, and you can't eat or drink anything for about 45 minutes to an hour prior to the test, because we want to get as many viable cells as we possibly can, because again, everything is done for DNA and genetic purposes. DNA is either blood or saliva, and saliva is just as good as blood because it's through your DNA. So everything is personalized to each individual patient based off of their own genetic makeup.
And then for example, what are some added benefits that FreshSkin is able to provide by using this testing when you're working with Dr. Ryan or Dr. Josie?
That's a great question. A lot of patients, every one size definitely does not fit all. A lot of patients will go on fad diets, diets that they see in Us magazine, or just diets that they read online. One of the biggest ones is the South Beach diet or the Atkins diet, which is low carb. And a lot of people try to do the fad diet themselves by doing, say, a low carb. We actually test, for the past 10 seasons of the reality show The Biggest Loser, we've tested all of the contestants. So last year, they had a contestant that she was, her mom was always telling her that she needed to be on a low carb diet. Well, in South Beach, Florida, they're known as the South Beach diet, which is low carb, high protein. Well, that patient actually came back as a low fat diet. So what did they do? They increased her carbohydrates and lowered her protein, balanced her out, and she actually started losing weight. So one size definitely doesn't fit all. Everyone in this office, 15 people I can see right now, could be on a low carb diet, and not everyone is going to lose weight. You're going to have about 8 to 10 people that will lose weight, but there's some people that are actually going to gain weight. And it's all based off of their own genetic makeup.
And then people that they yo-yo diet, for example, and they try all these different diets. Is that something that you guys can help with as well?
Absolutely, because they'll come in. They're coming in. They're talking to Dr. Ryan or Dr. Josie, and they're talking about what's going on. Why can't they lose weight, or maybe certain diets that they've been on before, and those are perfect candidates for our type of testing because it's more personalized for each individual patient. So we're really giving a more personalized approach. So basically, patients are going to come back, and we're going to recommend either a low carb, low fat, Mediterranean, or balanced diet based off of each individual patient's genetic predispositions. So we're talking about vitamin deficiencies, HDL, LDL, triglycerides. So if a patient, let's say they're deficient, or they're predisposed to be deficient in omega-6 and omega-3, their diet guidelines are going to be rich in foods that are high in omega-6 and 3, like fishes and whatnot. So,
and you could also do that with a supplement if
absolutely. So this is going to also it'll help physician optimize their intake for supplements as well. So.